Jacob Loomis. I'm in a group with Tanner Milliken and Kennedy Patterson. And today I'm going to be talking about our PSA on PAD. So you may be wondering, what is PAD? PAD is peripheral artery disease. So PAD is also called peripheral arterial disease. It's a common circulatory problem, which is when arteries are narrowed, and that reduces blood flow to your limbs, and that can cause several different issues. In the picture here, you can see that you have a normal artery on the left and a atherosclerotic artery on the right. Big words. That basically just means hardening of the arteries, and so then decreased blood flow occurs, and you lose feeling to those limbs. So some causes are atherosclerosis. That is where fatty deposits build up on your artery walls and reduce blood flow, kind of like I was talking about there. So that is the main cause in which you'll usually see if this is happening. The less common causes include blood vessel inflammation, which can cause the walls of the blood vessels to thicken, and that reduces the width of the passageway through the vessel. And so that can result in organ and tissue damage throughout the body. And there are many different types of this, and most of them are rare. And so you will mainly just see atherosclerosis, but you may see that as well. Injury to your limbs. Any injury to any one of your limbs, so your arms or your legs, can result in pinching arteries. So then you can begin to feel numbness and tingling. And that's why, like, when you go to the doctor, they'll ask you if you can feel you touching your hands or your toes. They'll feel for pedal pulses and radial pulses and things like that, because you may have that artery pinched. So certain treatments, such as radiation, used for cancer, can cause vasculopathy, which, when this occurs, it's a radiation-induced, and it can cause a narrowing of blood vessels. So basically the same thing as blood vessel inflammation, but the radiation causes it to inflame, and then a lesion occurs, and that reduces the blood flow. And then an unusual anatomy of your ligaments or muscles, that is just something you're born with, and it may not be something that you can fix, but it's just kind of going to happen. So some symptoms that you can look for if you may be experiencing this is cramping in your hips, because that can lead up to your hips. Leg numbness or weakness. Usually you'll be feeling this in your legs. It's not as common in your arms. So you most likely will be feeling this in your legs. You'll be sore on your toes, because that numbness and tingling will go down and kind of affect those nerves down there. You may see a change in leg color because you're losing the blood flow. Then you'll have, like I said, low pulse or no pulse in legs or feet, so that's why doctors will check for that. And you can check for that as well, and that's a good way to know if that artery is being blocked. And then pain when using your arms is kind of a arm symptom for if you are losing blood flow to your arms. So diagnosis. You can do a physical exam. So what they'll do is a weak or absent pulse below a narrowed area of your artery will show that there's kind of something going on there, and that can lead to knowing that there's a buildup in that artery. There will also be whooshing sounds over your arteries that can be heard with the stethoscope, so your doctor will go kind of over your body in certain places and figure out if they can hear those sounds, because that's a great symptom. Evidence of poor wound healing in the area where your blood flow is restricted, and so like I said, that's from injury. Anything can happen there, and the healing can cause certain issues. The picture you see there is the ankle brachial index, and what that is it compares the blood pressure in your ankle to the blood pressure in your arm, and so it should be the same in theory, and if it's not, they can kind of go from there, and it's an okay symptom to figure it out, and that way they'll know if there's decreased blood flow in your arm or if there's decreased blood flow in your legs. There's also blood tests. That is a sample of your blood that can be used to measure your cholesterol and triglycerides. And that is basically just to check for diabetes, which can be a symptom that can lead to the buildup of fatty deposits in your arteries. An angiography is using a dye that's injected into your blood vessels. This test allows your doctor to view the blood through your arteries as it happens, so they can watch it, and as it flows through, they'll be able to tell where it kind of narrows, and that's a great way for them to tell if that artery is narrowing and if you are kind of developing PAD. An ultrasound is also a good way, because they can evaluate the blood flow through your blood vessels, and they can identify those narrowed arteries. So some treatments we have here are medications, angioplasty or surgery, and therapy. So some medications include cholesterol lowering, high blood pressure, blood sugar levels, blood clot prevention, and symptom relief medications. So there's a lot of different medications that we can give for this, and you just have to consult with your doctor, and we'll kind of go over that with you and figure out what is the best thing for you regarding your life and your lifestyle. An angioplasty and slash surgery, that is a procedure where a catheter is threaded through a blood vessel in your body, and that towards the affected artery, and it will help with the blood flow to kind of clean that artery out and hopefully relieve that numbness and tingling in your legs. There's also a bypass surgery that what it is when a doctor creates a path around the blocked artery, and then they'll use either a blood vessel from another part of your body or a sympathetic vessel to kind of replace that if you're not able to fix it with angioplasty. So therapy, there's really one main therapy that we can do for this, and it's called thrombolytic therapy. And that is where if you have a blood clot blocking an artery, your doctor can inject a clot dissolving drug into your artery, and that will break it up and allow you to kind of go back to normal. So prognosis and follow-up is really important here. PAD affects not only how you live, but also how long. It's a pretty brutal thing to have because it can be very frustrating. And so you may find that you can't walk as far or as long as you used to. And so once this happens to yourself, and especially in the legs, it really will affect you for the rest of your life in a lot of cases. But if you take the right treatment and you follow what your doctor says, the chances of that happening lower significantly. So if you have PAD, you're also at greater risk for having a heart attack or stroke. So we will make sure to monitor that, and we need to make sure that you follow up with your doctor. So following up after endovascular procedures, which endovascular just means inside the blood vessel, so the angioplasty and everything going on, this will serve to prevent disease progression. And so if we are continually checking in with you and making sure that all of your symptoms are kind of lower, and making sure that we treat them with certain medications, and that you're exercising, training, and that you're just mainly keeping a healthy lifestyle, then that will be able to prevent any further symptoms and things like that. And then in some cases we may have to amputate and go further procedures, but if you can follow what the doctor says, the chances of that significantly lower. And so we highly recommend that you follow up with your doctor and just make sure that you are on top of things when it comes to this. So for all of our information, we got it from the Mayo Clinic, and so they have a great range of things that you can look at. And so if you have any more questions or things like that, you can check on mayoclinic.com.